My name is Yehoda Martei. I am a medical oncologist and also a researcher based at the University of Pennsylvania. And I work in the US and then also in Botswana, where I do most of my research in breast cancer and HIV. So antimicrobial resistance basically occurs when the antimicrobial medicines or drugs that we give to patients are no longer effective. And so these are things like antibiotics used to treat bacterial infections or antifungal agents. But essentially what happens is that these pathogens develop mechanisms that allow them to evade the drugs. And so it makes these infections much harder to treat. And so essentially patients who will typically be able to get oral antibiotics for an infection now have to be admitted to the hospital for treatment. They do get sick much quicker and so might need to go to the intensive care unit. Sometimes the complications are fatal and so patients might die as a result of these hard to treat infections. So I work in different settings. So in the US, I think we have access to a lot more antibiotics. And so even with resistant organisms, we have a team of infectious disease that can guide us in terms of choosing the right antibiotics for resistant organisms. But sometimes we don't even have the right antibiotics for these organisms, and it makes it really hard to treat. In places like Botswana, where I am currently, it's even more of a challenge because it depends on what antibiotics is in stock. And so, um, these are just patients who are just really difficult to manage and they're critically ill. And a lot of the times you're sort of fighting against, infections and other complications of their infections, to avoid a fatal outcome. Yeah, I think it's much harder in Botswana. I think one of the challenges is just having the diagnostic capacity. So to be able to even tell what type of infection someone has and to be able to tell what antibiotics they're resistant to requires having a functional lab that runs every day, including weekends, and being able to get those results back within 24 to 48 hours. And that's not guaranteed in places like Botswana or even other African countries. And so that makes it more of a challenge. There's also not a specialized team of infectious diseases who focus basically on just cancer patients, which is something I have in the US. And so I think there are definitely more resources in the US, which makes it still harder to manage these infections and patients to get sick. But I think it makes it even harder in places where there are low resources in terms of diagnostics and medicines that are available to treat these infections. So I think globally, the sort of more fundamental principles of global health that help address infections and antimicrobial resistance. So things like improving access to clean water, water sanitation, increasing vaccination rates definitely helps. I think increasing access to diagnostics. So I think globally, the sort of fundamental principles around global health that are critical to controlling infections and antimicrobial resistance. And so things like improving access to clean water, water sanitation, increasing vaccination rates are critical. But I also think increasing access to diagnostics and antibiotics in low resource settings are essential. Importantly, I think we really need to invest a lot of money, funding into increasing the research pipeline of medicines used to treat resistance infections. And so I think there's definitely very little research ongoing in antimicrobial resistance and the development of new drugs, and that will be critical to being able to address the issue of antimicrobial resistance. I think when you think about One Health, you can think about so I think AMR is a huge global health issue currently. Just for perspectives, we know that 5 million deaths occur a year that are associated with AMR, and so this is a huge, like a pandemic of. This is a huge challenge, and I think it's going to be an even bigger challenge for those of us in the cancer community because how we treat patients who are affected with cancer is going to be severely impaired if we don't have antibiotics in the next 10 years, in the next 5 years, even to treat some of these resistant organisms. And so I think it's something that I think people are aware, some physicians are aware, but the global scale of this problem is underappreciated. And I think it's a critical issue and we really need to be focused on it right now to to make sure that future generations have access to antibiotics. I think it's someone who treats patients both in the United States and in Botswana. I think one thing that's critical is really how we integrate. Well, I think one important thing I want to highlight is that I think there's been a huge focus recently on national cancer control plans, which I think is great. But I think a lot of them are missing an infectious component. So thinking about how we build infrastructure for accurate diagnostics and managing infections in patients with cancer, I think we can't really make a lot of progress for cancer patients unless we address infections and antimicrobial resistance adequately. And I think that's really lacking in a lot of national cancer control plans.